Thank you everyone for coming to tonight's webinar with the new dentist panel discussion. We have some wonderful new dentists here for you tonight to answer any questions that you have. They'll first go through and introduce themselves and just tell you guys a little bit about them. And then we'll go into some pre-submitted questions, and then we'll open up to live Q&A and then go into some other things after. The whole webinar should take maybe 45-ish minutes. All right, Dr. Nguyen, you can get started.
Hi everyone. You can call me Dr. Selena. I graduated in Temple Dental School in 2020. I was born and raised in the suburbs of Philly, so I just kind of never left, and I'm still in Philadelphia. I currently work at a FQHC called Project Home. I am the past chair of the PDA New Dentist Committee, ADA ambassador, the current president of the Chester County, Delaware County Dental Society. I was a part of ASDA since like my D1 year, and just stayed involved in organized dentistry. Um, I have wanted to be a dentist since I was 9 years old and have worked in all the practice modalities of dentistry. So I like to be a good resource and like a knowledge bank or um, for people who kind of want to figure out how they want to go about this career. In my free time, I like music festivals. I like cosplaying at Comic Cons and cuddling with my dog, Ozzy. You might see him walk by during this presentation.
Good evening, everyone. My name is Lauren Yap. I am a graduate from Temple University as well. In 2019, I did the DMD MPH Masters in Public Health program while I was there. After graduating from Temple, I decided to take a leap. So I'm actually from Maryland, and I decided to move past an ocean into an island. And so I lived in Hawaii for a year where I did an AEGD. And I see that we have some questions about that, and I'd love to talk about that. It was one of the best experiences, both personally and professionally for me. But ultimately, my heart drew me back to working with children. So I ended up coming back to Pennsylvania, where I have lived probably almost the same amount of years here than I did when I was in Maryland. And I became a pediatric dentist. Following that, I decided to enter academia, which was something that I always wanted to do, but didn't think it would happen so early on in my career. So I actually am like a hybrid because I work both in academia as well as in private practice. I currently am the assistant program director for the pediatric residency at University of Pennsylvania Children's Hospital of Philadelphia, as well as working at a private practice. And I'm just really happy to be here tonight to chat with all of you, to answer any questions, and to kind of share some old dental school stories. And Dr. Nguyen and I actually we were in ASDA together, and we were ASDA roommates all throughout our time at dental school.
Hi, everybody. My name is Seth Walbridge. I am slightly out of the new dentist realm, but it's good to get, a variety of perspectives. But I previously served as the chair of the ADA New Dentist Committee, and I was on the board of trustees at the ADA for a year. I'm currently a trustee for the Pennsylvania Dental Association's second trustee region, which is a new name given to the districts. And I'm a trustee on the foundation board for the International College of Dentists. So pretty busy. And then something that I'm proud of, I've never owned a dental practice. I'm about 15 years in now, and I never want to own a dental practice. So I'm having a lot of fun not being an owner, and I'm just kind of loving the lifestyle that comes with not being an owner. So other than that, my wife's a critical care anesthesiologist, so she's busy, and we're doing our best raising our two children. So other than that, I work in Easton, Pennsylvania, home of Crayola crayons, about an hour north of Philadelphia. So thanks for being here.
All right, we'll go to the pre-submitted questions first. So we'll start with the first one. How has it been managing student loan debt, if you are comfortable sharing?
So, working in FQHC, I'm lucky enough to be in a loan repayment program. through the state, and there are also programs that are federal as well. Before I worked at an FQHC, I was paying off the highest interest loans as much as I could, just saving up money. So it's very important to do that. But if you are interested in working like public health or even in an academic setting, loan repayments are a very good idea to help you out.
I'll jump in. It's kind of just a little different perspective. I kind of took the process of investing. So I kind of slow played the school loan payoff. Took me about 12 years to pay mine off, but I invested at the same time. So I know there's kind of you either do the Dave Ramsey approach and it's like pay off the debt as fast as you can, pay it off in 2 years if you can. I kind of was in the middle. We invested at the same time as paying off the loans. So it seemed to just work out well. It was stressful, having, school debt for a long time, but we were able to invest and, our investments have, for 12 to 15 years now, they've been growing. So we're happy we did it that way. Just a little bit different perspective.
Okay, we'll go to the next one here. How did you go about finding a good fit for a first job and negotiating contract/salary agreements? If everyone wants to touch on this one here.
So for me, looking for my first job, I was honestly thinking after finishing residency that I wanted to go into private practice, or a federally qualified health center. But through kind of the community of organized dentistry, one of my colleagues mentioned to me about a possible part-time academic position, at University of Pennsylvania. And so it's really important, coming out of dental school to maintain relationships and to maintain, mentorships, because they can really kind of help guide you and they can present opportunities to you. And so that's actually how I found out about this job that I'm in, which has actually been my first and really only job. I've been there, but my role has kind of evolved throughout the years of being in practice. And in terms of negotiating contracts and salary agreements, I know that within the PDA, there's an option to be part of, the financial like literacy program, which was really helpful. Even joining different associations, they have relationships with different associations that can help you review your contracts. But for me, it was also kind of going back to that community that I had with organized dentistry and asking them like, hey, what are things that I should look out for? What are things that I should ask about? What are things I should be, making sure that are things that I'm advocating for myself to protect myself?
I was a little unfortunate in that I graduated during COVID. So finding a first job was very difficult. I ended up going with a DSO as my first job, and it was not where I had thought I would start out my career in. But I will say that I was really glad that I started out there because I kind of just hit the ground running. I got my reps in, got really fast and very independent, which I don't think that I would have become had I not taken that route and gone that modality of practice. I, in terms of finding that job, I used uh, apps like Indeed. I used LinkedIn a good amount as well, just trying to network, and went through a lot of interviews as much as I could during the COVID times. In terms of negotiating contracts and salaries, just as Dr. Yap said, I relied a lot on colleagues to have a better idea of what I should be looking for, so that I can get the most out of what I wanted of a job. Um, there are a lot of things that dental school may not teach you necessarily because you're just so focused on the clinical aspect. So it's good to hear from people who are in the field already and working for that input. I also had my own lawyer as well to look over the contract, just to make sure that I understood the terminology and the legal terms within it.
Okay, so that kind of answers the next question as well with who to trust to review a contract. So that is wonderful. And then, oh, you can take this one as well. What was the hardest thing you've encountered since graduating? And then for those of you that did a GPR, AEGD, did you feel prepared after?
I'll jump in. I did not do an AGD or GPR, and I regret it. I think that they're very beneficial, and if I could do it over again, I probably would do it. I had a dentist kind of closer to home that said he was a multi-dentist practice. They'd be able to pay me what I needed, educate me, be my mentors, that sort of thing. And I think that was a mistake. Um, I learned a lot, but there were a lot of red flags at the same time. Um, so, you know, along with that, it just kind of came with how do you talk to patients? I'd say that was probably the hardest thing. I'm interested to hear what Lauren has to say because she has to deal with parents of kids. I'm sure she has a couple of stories about that. But confidently talking to scared patients, I think, is the hardest thing. And you'll just get it over time. It probably took me 3 to 5 years, but don't be afraid to take courses. Public speaking, even how to talk confidently to people. It'll go a long way for you.
So I'll jump in. I actually kind of thought about doing pediatric dentistry towards the end of my third year in dental school, and I felt like a lot of people knew that they wanted to specialize so early on. So I felt like I needed a little bit more time to really know that this is what I wanted to do for the rest of my life, especially in pediatric dentistry. It's a loud specialty. Our patients like to sing, as I like to call it, and our parents sometimes like to yell. So I wasn't sure if I was really ready to commit to that. So I decided to look at GPRs and AEGDs, and I interviewed at an AEGD because that year the GPR in Hawaii was undergoing accreditation. So I ended up looking at AEGDs, and the clinic that I happened to match to and that I interviewed with and I loved, I think was, like I said, the best thing that I could have done personally and professionally. There were three things that I really value about my experience with the AEG. The first thing was about treatment planning. So when you're in dental school, you do things in a certain order because that's how you're supposed to. That's the way that the flow works. You need to get swiped off so you can move to the next step. In the AEGD, it was okay, how do you want to do it? And what steps and what are you going to prioritize? There is no swiping off. There is no, there's somebody there to talk things with, but really you have to rationalize and you have to educate yourself as to why do you do caries control before you do, the definitive restoration that you're trying to do. The second thing was speed. I didn't have to worry about producing because I was salaried and our clinic was a federally qualified health clinic on a neighboring island, so we were very busy. And part of the agreement of me matching there is that they knew I was interested in pediatric dentistry, so they funneled all the kids to me. So it was an opportunity for me to work on my skills as well as my speed and my efficiency, because I think oftentimes in dental school we think about speed, but it's really your speed and your efficiency. Because if you're not efficient with your time, if you're not efficient with your behavior management, you're not going to be able to actually move through that appointment quickly. And then lastly, like what Dr. Walbridge said, is like talking to patients. And for me, it's talking to patients, both the little one in my chair as well as the adult that brought them there. And so it was an opportunity for me to practice, how do you communicate with patients that perhaps are, they have low oral health literacy? Or how do you communicate with patients that really want to and they're motivated, but they have a lot of restrictions and they have a lot of barriers to achieving optimal oral health care? So those were the big three things that I felt like I accomplished in that AEGD program. And I think if anybody is interested in pursuing a GPR or an AEGD, I am in full support. I always tell the dental students at Penn when they ask me, you have to do your research though. You can't just like apply, kind of willy-nilly. You need to see what is an actual day in the life for that resident. And is that something that you are interested in? And does that fulfill the goals that you're hoping to accomplish in that year following dental school? So a little bit of a long-winded answer, but hopefully there's like a nugget or two that you can take from that.
Okay, we can move on to the next one. What's the job market like for new graduates in Pennsylvania? And if you want to go over some of the common interview questions or questions you were asked, that would be great too. Dr. Nguyen, do you want to start with this one?
Sure. Let's see, I have gone job searching one, two, three times now in my 5 years of my dental career working. I would say that the job market is not too bad in Pennsylvania. There are plenty of job opportunities. It's more so finding the job that fits best for you and being in the area that you want to be in. Um, I would say, let's see, most common interview questions. Um, when I was starting out as a new dentist, a lot of the questions were based on how much I could produce. So it'd be questions such as, how long does it take you to do like a class two filling, for example, or how long would you need to do a core buildup and crown? Um, Starting out in my first year for those interviews, it was very difficult to answer those questions because I only had to go off of the time of dental school, which is like, yes, I can do a crown prep in 3 hours. But what I realized as I was going through the interviews was that it's a really good idea, even if you're in the dental school clinic, to just kind of keep track of your time of when you're actually doing the procedure itself. Then you have a better idea of what your timing is like to be able to answer those questions when you're doing those job interviews, if you're going straight out of dental school to work. So kind of keep in mind that a lot of times when you are interviewing, especially for private practices, production questions are important. They also want to know your skill set, things that you have experienced as well in the clinic. Not everyone has the same experience as in dental school as everyone else. So if you can pinpoint really cool cases or things that you saw or shadowed for, those are good things to note as well.
Okay, we'll go to the next one. As a new grad, how do you handle situations when you need help or are unsure what to do? If everyone wants to chime in for this one.
I'll go first. So I'll tell you what you don't want to do, and that's post or rely on social media. I can't tell you how unethical a lot of these posts are. A new grad wants some help, and they post on there thinking that they're going to get the most experts looking at this one thing, and they're going to get a lot of points of view. I mean, they're degrading, they're saying all these bad things about it when they're just looking for help. I feel like dentistry on social media, they want to eat their young like so fast. So I would not rely on social media. I never post anything on social media if I need help. Um, I rely on mentors, colleagues, and um, my local dental society. There's a bunch of friends in there. We bounce cases off of each other. I'm part of another group where we just get together on Zoom. We're sharing things online with colleagues. We invite, dentists with some experience to be in there, and we bring specialists in. If you ask a specialist to meet with you on Zoom, 9 times out of 10, they're going to agree to it. If you want to run cases by them, And it's a good way to get referrals for patients as well. So please don't rely on social media for to find help. Find colleagues, mentors, and don't be afraid to go to local meetings and bounce ideas off people in person.
I will echo Dr. Walbridge's great sentiments. And I will say, like, I think we belong in a profession that's like very community based, right? We spend a lot of time talking to our patients and hearing their stories. And then we take all this information in and who do we kind of dump it onto next, right? And in dental school, there's a lot of camaraderie because even once you are in your third and fourth year in your respective clinic groups, you still have that clinic group to go to. And so I think it's a little tough when you kind of make that next step. Who do you go to? So one of the things that I would also add on to Dr. Walbridge's great advice is, keep in touch with your dental school friends. If you choose to go into respective residencies or GPRs or AEGDs, it's always really nice to keep those connections because ultimately we all want to help one another, right? Nobody really wants their colleague to suffer. And I think that that's something that I learned really strongly in organized dentistry. People would come up and would talk to you and be like, okay, like, what are you up to? What are you looking for? How can I help? Even without me even having to say, like, what do you think about this? Um, and so I think that, making sure that you maintain a community, whatever that community may look like to you, if that's, friends from dental school, your local dental society, or even, a study club, or joining an association that you feel very strongly about that fulfills your vision and your mission statement, make those connections. And I think people just organically want to help one another in our profession.
Okay, we'll go on to the next one. What are some things we can do in school that would set us up for being good clinicians?
I, I could answer this one coming from, I guess, a perspective of a faculty member. One of the things that I always encourage both dental students and residents to do is, to be a good clinician, you have to listen to your patient, listen to, your faculty, your attendings, but also put yourself out there. Oftentimes there, an attending or a faculty member may suggest that you try a different procedure or try doing it a different way while you're in school. And I think being open and being adaptable and flexible to learning, you might pick up something from, that procedure that you completed with a faculty member, or maybe you'll say, like, this instrument doesn't work for me. But I think the best thing you can do in school to set yourself up is to be open to any type of opportunity that can come your way, whether it's a procedure wise or whether it's dealing with a difficult patient. At least when you're in school, you know that you have that backup, you have that, faculty member net that's there to, kind of bail you out if you need it. But I would definitely just say being open to those experiences.
Okay, and the next one, if I plan to work in a big city where dentistry is saturated, how can I find the most suitable job for me? If anyone has any input for this one.
I'll go. You better shadow. You better get in there. I mean, there's a lot of practices in big cities. I lived in Michigan for a year while my wife did her fellowship in critical care, and I ended up working part-time at a prison. So part-time at a prison and part-time at a private office, and I loved it. So it was just hard in downtown Michigan. It was very saturated. So as I shadowed, I kind of found that, they were all just trying to outdo each other, mainly with production. So that they were very production driven. Wasn't a lot of good patient care in my opinion. Nothing that I would want to be a part of. But you gotta know what's going on. So don't be afraid to even just call an office if you're interested and shadow them, especially in a city. I would shadow as many offices as possible and pick up little tidbits here and there. You'd be shocked at, one interaction you have with a dental assistant. You can learn a lot about an office and maybe what you want to be a part of and what you know, would never want to be a part of. So that's my big takeaway. Just you got to put the boots on the ground and get into some of these offices, especially in the big city.
Okay, we'll skip the next one. I feel like Dr. Yap answered that one pretty well. And the next one is how did you find a mentor and how did you find a clinic to work out that matches your values and goals? So I do want to chime in on this one here. I believe on a later slide I will have the link, but PDA has a mentoring program. It's called Connections. So we will match you with a mentor based on practice, type, location, and specialty. So I did want to throw that in there. You guys are welcome to join as students. We have quite a few in there already. But if anyone else has anything to chime in about how they found their mentor as well, go ahead.
So I found my mentor through being a part of organized dentistry, like specifically the ADA and the PDA. And that's actually also how I found my current job as well. My dental director of my FQHC is also very active in the PDA and ADA. And I just so happened to have met her at a PDA social right when I was looking for a job. So it was very good timing. But it also comes to show that the networking in organized dentistry can just help out so much. And if not everyone is always so lucky to have a mentor that they've, have known when they were growing up or is within the family. So a good way to do that is just to seek your local dental society, or even if you are moving across states, across counties, you can just contact that state association, and then they'll hook you up. And they'll find someone that either has is in like a similar field or specialty, either has the same hometown or just is willing to help you. And there always is someone who wants to help.
Okay.
I had a couple of my mentors as a dental student attending Pennsylvania Dental Associate PDA events like this. And, a relationship was formed and we talked. And as my, career has evolved and perhaps some of my mentors have, taken a step back in organized dentistry or maybe, partially retired or retired, they've always been there for me, even just to talk things out. And I think that was one of the reasons why, I like to come back and to talk about these things because you want to pay it forward for the next group. And so I'm really thankful that the PDA puts up events like these because it facilitates conversations, and it brings up topics that perhaps you're wondering about, like, these questions, but where do you find the answers to these things? As Dr. Walbridge mentioned, social media doesn't always give you the most accurate answers, and you don't learn about these things in dental school. So, any type of events that the Pennsylvania Dental Association put on when I was a dental student, I went to, and I'm really thankful for it.
I just wanted to chime in with if you attend any of these local dental society meetings, they want you there. You're probably going to get dinner on them, and it's a really good way to actually learn about the area you're in. Especially, I know Lauren and Selena are in Philadelphia. I lived in Philadelphia when I went to school there, but the restaurant scene is really cool. And usually, a lot of these dental societies they'll do something at one of these venues, and I just want to throw that in there. A lot of times, you'll get to meet friends, you get to have a nice dinner with them, and you get to kind of see some areas that maybe you didn't see before. So definitely reach out to these local dental societies, and you can ask them to attend, but I more times than not they're going to be more than happy to not only let you attend but accommodate you as well.
Okay, great. Our last pre-submitted question, and then we will go to other questions in the chat box. So if you have anything you want to ask, you can feel free to type down in the chat box now, and then we will go over them after this one. If everyone wants to answer this one as well, what are some mistakes that you made as a new dentist that you would advise to avoid?
I'll go first. I made a lot of these. But the big one for me, like in when I was thinking about this, was kind of pigeonholing myself into one area and with the same people. So if you only know or you only have one mentor or you're only listening to one person, I was only listening to the two dentists that were above me in the practice I was at when I first started. And I thought they were, gods among men. They knew everything and that I was going to listen to them because they were successful. What a mistake. Um, when I left that practice, I was there for 3 years. I mostly found things that I didn't want to do and how I didn't want to be as a dentist. So definitely have multiple kind of outlets for mentorship and don't pigeonhole yourself into, one office with, only one person to talk to. Make sure you're also involving seasoned colleagues, but getting new ideas from your younger colleagues too. That was huge. I'll talk forever on this, so I'll let someone else talk. I made a lot of mistakes.
I did too. One of the things that I would say is, we all have imposter syndrome, especially after graduating. And I think I really kind of leaned into imposter syndrome, and felt like, I was in this dark hole. Like if a procedure didn't go well, or, I see one of my, fillings come back and I'd be like, oh, that's so awful, but I was ashamed to open up to somebody and to ask those questions because I thought maybe those are questions that I should already know the answer to, or I don't want to show this. I don't want them to think I'm not qualified or I'm not competent. But truly, we're all human. We've all been there before, and I think that part of learning and part of becoming a better clinician, and part of being a better provider for your patients is owning up to what you don't know and asking those around you with various perspectives, as Dr. Walbridge mentioned, for help. And maybe they can point you to a resource. Maybe they also have had, made those same mistakes or encountered those same problems. But it doesn't always mean that you have to face these things alone or you have to reinvent the wheel by yourself each time.
I would say one of my biggest mistakes was that I would be afraid to leave a job, or that I was afraid to change a directionality of how I wanted to go about my career. I had always thought that I wanted to go into private practice, and I actually had to bounce the idea off of like Dr. Yap about going into public health because it was just different, and not something that I had thought about before. So not, just being afraid, listening to, your wants as a clinician, and, what you find fulfillment in, and believing that that's what you deserve, is very important. I will also say that mistakes are unavoidable. That's just how it is in any field, but especially in the dental field, that's how we learn. And that's how you gain experience. We will make mistakes and we'll learn from them, and we just become better people because of that.
Okay, and let me pull up the chat here. Oh, somebody asked if there will be a recording, and there will be a recording, and I will be sending it out in the post-event email, which I will get to here soon. Does anybody have any additional questions? You can either unmute or type in the chat now. And I'll go on to the next slides here. You guys can continue to send any if you have. I wanted to talk about the next webinar. It is Grad 101. It is Tuesday, November 4th at 7 p.m. We will have someone from PDA talking about the application process and what you need to be licensed. We will have someone from the ADA talking about insurance and what you'll need insurance-wise. We will also have a dentist who recently purchased a practice, and he will be talking about his journey, including tips on navigating the buying process. And then we will have another dentist who's going to talk about networking and mentoring opportunities as well. So the QR code is here on the screen if you would like to register for that. All right. And then as a student member, you can receive discounts on various products, including laptops and other tech. To view a complete list of Member Advantage partners, you can visit the web address shown on your screen here. Okay, we do have a question here. Do you recommend consulting a lawyer or consultant to review the contract for jobs?
I'll go first. A lawyer is good. Um, I review a lot of contracts for people. I think it's really good to know kind of what your colleagues are getting in their contracts as well. So we actually do a lot of contract comparison, depending on where you are. It's always good to have a lawyer see your contract, especially when you're a new grad. When you're about 5 years out, you're going to know what should be in the contract. So I think when you first start out, absolutely have a lawyer look at it. But I would have someone honestly on like the new dentist committee look at it, or someone that has recently graduated that has experience. Because when I graduated, I didn't know you know, what should have been in a contract, and there were some mistakes that I made on my end. So a lawyer's great. I think as a new grad, you have to do it, but definitely make sure that that contract is passing through some colleagues' hands as well.
If you do, go with a lawyer in the beginning. Also, just make sure that it's a lawyer that has worked with dental contracts specifically. There, of course, are many different types of lawyers, but there are just certain clauses in dental contracts that are just very specific to our field. So just make sure that they have that experience in their portfolio.
I review a lot of contracts with my residents, and I think one of the things before even reviewing the contract is just, ask yourself what are things that you're looking for, what are things that you're willing to compromise, and what are things that, you for sure do not want to have to deal with, because that helps you at least look at the contract in a different way. If you look at the contract, everything sounds so novel or it sounds so great. So I think coming in with your own expectations and then reviewing them with somebody that's, non-biased, and we can kind of go through and compare, where your list is and what the contract says.
Okay. And I don't see anything else in the chat here. So I wanted to go over something else. If you've been in our webinars before and would like to leave a testimonial, the link is there on this screen. And as I said earlier, I will be sending out an end of event survey. For completing this survey, you will receive an Amazon gift card. So please complete that. And then I will also include the recording and then the link to request a mentor in the post-event email as well, since it was not on these slides. So I will be sending that out probably tomorrow or Monday at the latest. So just keep an eye on your email, and I will bring this back up here in case anybody missed this. And I want to thank our presenters tonight for telling us about their stories and answering all of the questions. You guys did a wonderful job, and I want to thank everyone for coming tonight as well. And if you have any other questions, you can respond to my email and we can get them answered for you. So already I will go ahead and end. Oh, there is something in the chat. Oh, just some
Yep.
thank yous. All
Thanks,
right.
everybody.
Yep.
Good
Thank you,
luck.
Great
everyone.
night. Yeah.
Bye.